So, this video, I want to cover two different things that you can do if you have a history of trauma. And so, if there are traumatic events in your past and you are dealing either with post traumatic stress disorder or you are chronically ill in some way, shape, or form, you need to process this with a professional, or I'm also going to give you a type of trauma journaling. But the first thing that I recommend to patients, if we know they have a significant trauma in their past and they can remember the specific event, is a practice called EMDR. And EMDR should be done with a counselor or a psychiatrist, psychologist. I do not do EMDR. This is not something that I do in my treatment room. However, I have had patients do it with good results, and so I do like EMDR as a treatment for specific traumatic events in your past. The next thing is trauma journaling. And so, with the trauma journaling, what you do is you take what you feel like is the most significant trauma in your past and you write about it 4 times. And the research that was done on this showed really excellent results as far as helping you process the trauma, as well as other positive health benefits, including stimulating the immune system. But you do this in the research, they had you either do 4 days in a row, so every morning for 4 days, journaling for at least 30 minutes each time on the event that you feel like is most significant, and anything that comes up as you're journaling about that, if you think of something else and takes you off down a different path, then they encouraged you to go ahead and head down that path and see where it takes you. Or if you don't do it 4 days in a row, then you pick one day a week and you do it for 4 weeks. So, for example, maybe you do it on Monday, and for 4 weeks you journal for 30 minutes each time about the same event, and they saw the same results roughly doing it either 4 days in a row or doing it a week apart, but each time 4 times. And this is not, I will admit, this is not something that I've had a lot of patients do yet, but there is good research to show that this can be beneficial. So I just want to mention it. I always want to give you as many options as I can to help benefit. Now, if you guys know of something else that works and works great, would love to know about it. I'm always interested in learning new things to help benefit my patients. So I hope this video helps, and please look for my next video. Thanks.